We're so happy to see so many of you guys joining us today. Have an exciting presentation, lots of topics to explore, from just basic fertility and gynecology to more advanced topics. So excited to have this next hour to spend some of this time with you and hopefully be informative and give you some next steps and food for thought. All right. Okay, quite a few people joining us already. We'll wait maybe just another minute or so and then we'll get started. While we do that, I just want to take a moment and introduce some amazing people on our team. So Rebecca Kindbody is our VP of Brand and Marketing, and the privilege of being also my friend, and has also frozen embryos with Kindbody this past year with her wonderful husband. So Rebecca, hi, how are you?
Hi, everyone. So glad to be here.
Excellent. And then a couple of physician colleagues are here with us. Dr. Jasmine Pedroso, who is a OBGYN and minimally invasive surgeon, who's joining us from our San Francisco. Hi, Jasmine.
Hi, everyone. Hi from San Francisco.
Amazing. And as you guys can see, she's in our San Francisco office, I'm in our New York office, but very similar feel. Behind both of us, it says "Own Your Future," which I think is a great way to live by. And then Dr. Rebecca Nelkin, who is in Los Angeles, also an OBGYN and urogynecologist as well. Hi, Rebecca.
Hi, everyone. So great to be here. And I'm going to be in the Century City office.
Incredible. And then we also have one of our reproductive endocrinologists and infertility specialists, Dr. Rachel, who is on this call as well. Rachel, hi.
Hi, everyone.
Good to see you today. Thanks you for joining us. Of course. So we're going to get started, but before I do, I just wanted to wish everyone a happy holiday season. As you can see, we're festively decorated here, and happy Hanukkah to all of you as well, as tonight is the first night of Hanukkah. And we know that this year has been a year like none other. And so we hope that everyone has a reason to celebrate this year, even though it may look a little bit different than what you're used to. And from our family at Kindbody to all of yours, we wish you and yours a really wonderful holiday season. The topic of this evening is Fertility 101, and we call it our holiday. Not necessarily because fertility changes because it's the holidays, but we like to be festive. So here we are. And I'm Dr. Fahima Sassan. I'm the founding physician of Kindbody. I'm also a board certified OBGYN. And these topics are all just really near and dear to my heart. And I feel that a majority of us really know very little about fertility. And so I hope that you find this next hour informative. Without further ado, we'll get going. And so if you want to drive for me, we'll get started. Okay, so meet Kindbody. So what is Kindbody? Where Kindbody is building a national network of women's health and fertility practices with a key focus of improving access for all. We really serve patients directly. We work directly with employers to also improve access through fertility benefits. And really a fundamental focus of Kindbody is to bring together everything that you would need, whether you are just looking to find a place to get a pap smear, to going through the entire reproductive fertility journey, whether you need donor egg, donor sperm, surrogacy, the entire spectrum, to really provide all of that under one comprehensive, so that you don't feel shuffled around. And we're here to really be the one place you need to go for all of those comprehensive services. And as you saw in our introductions, we're located in New York, Princeton, New Jersey, San Francisco, soon in Los Altos as well. We're in Santa Monica, Century City, and Los Angeles. And over the next 6 months, we will be in Seattle, Washington, Atlanta, Georgia, and Orlando and Austin, Texas as well. So really want to be here for everyone, regardless of where you are in your journey. All right, so what do? We do the full spectrum of fertility care from fertility assessments. So you're just looking to learn a little bit more about your fertility, to virtual consultations, which are now becoming more important than ever. But fun fact, Kindbody was doing virtual assessments well before COVID. So it's something that we feel really proud of. And it's something we were seamlessly able to start doing at the very beginning of this pandemic. And we're really happy that we can continue to provide that service. We also do egg freezing and embryo freezing, depending on where you are in your life's journey, and intrauterine insemination and in vitro fertilization. So the full spectrum of fertility care. We also provide comprehensive gynecologic care, including pap smears, well-woman checkups, contraception, IUD, so anything that you would need as it relates to your gynecologic needs. And then, of course, no fertility service would be complete without including our LGBTQ community. So donor eggs, donor sperm, surrogacy, and how does all that come together? And then when we talk about fertility, no fertility conversation would be complete without addressing the entire body. So mental health and nutrition become so fundamentally important because really, as gynecologists and fertility doctors, if we are only taking care of your uterus and ovaries, we've colossally failed you. And so we have nutritionists, therapists that you can schedule appointments with directly through our website. So that's what we do. And next slide. All right, so a little bit of update. As I started this conversation, gosh, this year really has been a crazy one. And as a result, unfortunately, a lot of people in the population have really stopped getting some of their general health care needs. And there's been a vast decline in women going and getting well-woman exams and mammograms and pap smears and just taking care of our regular health. And I just want to take a moment to emphasize that when this pandemic was only going to be a month, which is, what I wished for back in March, that may have been okay. But now as we come upon a year of dealing with this, it's really fundamentally important to understand that it's important to take care of ourselves. Go to the gynecologist, get your well-woman checkups, don't ignore symptoms that you might be having, waiting for the pandemic to be over. But also to understand that fertility, unfortunately, does not wait for COVID-19 vaccines, right? Fertility is so time sensitive. And we just want you to know we're here. Your safety is our utmost priority. We do as much as we possibly can to do screening prior to even entering our doors, offering virtual and inpatient consultations for the comfort and safety of you, as well as doing temperature screenings, mask wearing all of the time, as well as very thorough health screenings for everyone that enters the facility. So your safety is a priority, and we're here to help you. And we think this is important now more than ever. All right. So Fertility 101, why does this matter? Well, one of the biggest concepts of this is I feel like, as we think about fertility, is we spend, specifically as women, I think men do too, but definitely women, we spend our entire lives or the majority of our lives trying desperately to not get pregnant, right? And so then when the time comes where we're ready to conceive or we're ready to start thinking about our future family, we kind of don't know where to begin. And it's to no fault of our own. And there's fundamental lack of knowledge relates to fertility and women's health. And that lack of knowledge is not unique to you or your friends or your circle that you go with. It's true even when you talk to other doctors. So that even people who have gone to medical school and have gone through residency training, unless they happen to be OBGYNs, tend to have very little knowledge of fertility and female reproduction. And so we're really here to make that right. We want to empower you with information and so that you have true facts to then make decisions that are right for you. All right, so what should you know? The most important thing is when it comes to fertility, age is fundamentally important. I wish it was how well you took care of yourself and what you ate and how much yoga you do or whatever it is, but it's not really about our lifestyles. It's not really about, something that we can then make better. It really has to do with age. So fertility is really a direct product of time and age as it relates to your egg count. Next slide. So let's start at the beginning. Why does this matter? Well, as women, we're born with all the eggs we'll ever have. We have about 2 million eggs at birth. And this is crazy, but by the time we reach our very first menstrual period, so think back to yourself how old you were. Probably you were somewhere between 9 and 13 or 14. But even if you were a little younger, a little older, by the time we reach our very first period, we go from 2 million to 300 to 400,000 eggs. And then from there, every single month, we lose up to 1,000 eggs. And I hope your jaws are dropping because I think this is crazy and totally not fair too, but it's the reality of what happens. And that decline is a steady decline from birth. So some of the misconceptions that exist is that somehow fertility is perfect, and then at some age you fall off a cliff. But the reality is that our fertility is declining from the day we are born. And so it becomes really important to then understand, well, what is my fertility like today? And what will my fertility potentially be like in the future as we make our decisions about that ideal family we want to have and when we're going to have that family, how far are we going to space our children, and all of these things, which I understand some of you may be sitting there and going, I don't even know what I'm doing next week, much less how many children I'm going to have and when I'm going to have them. But these are important things for us to start thinking about. And so the key thing to understand, though, is we're born with all the eggs we'll ever have, and we can never make new eggs. Next slide. All right, so what's this whole thing about age? Why do people talk about 35? That's going back to that whole thing I was telling you about, this misconception that you're perfect, and at 35 you fall off a cliff. But the reality of it is that most women, the reason why this 35 exists is if you're losing eggs from birth and you're steadily declining, most women by the time they reach 35 in their late 30s may have lower egg counts. But the kind of sad part about it, though, is that 1 out of 10 women, up to 20% of women, can have premature decline in their egg counts. So that 1 out of 10 women will have low egg counts even prior to the age of 35. On the same token, there's some 40-year-olds who are still fertile, but there unfortunately are some 30-year-olds who may not be fertile. And so the bottom line is that we owe it to ourselves, we owe it to that ideal family, we owe it to our future partner or our current partner to go and learn the facts about our fertility today so that we make educated decisions that are not based on fear, that are not based on hypotheses, and they're actually based on our own egg counts. And so we'll talk about how we can do that. Next slide. All right, so far we've been talking about egg count. The other factor that's equally important when we talk about fertility is our egg quality. And why is this important? Well, remember I mentioned you were born with all the eggs we'll ever have. Well, those eggs are going to continue to be as old as you are. So at any given moment in time, your eggs are as old as you are. And so eggs age as we age, the egg quality declines. And what I mean by quality is there's 23 chromosomes that make up an egg cell, and those chromosomes, that DNA material, deteriorates. The same way you get wrinkles, you age, or your hair turns white, or your skin looks different. All those factors are a result of our cells aging, and one of the cells that continues to age is also our egg cells. And quality is not something we can check, so it's just something we need to constantly be aware of, that as we age, our egg quality also declines. Next slide. All right, so what is the bottom line? Well, you're never too young or too old, for that matter, to learn more about your fertility and how it works so that you can then be empowered with the knowledge of your own fertility and then use that knowledge to make decisions that are right for you. So that maybe the correct action is that you want to freeze eggs because you don't want to have kids for another 10 years. Maybe you're ready to have a baby now and you realize, wow, I really need to take some action there. Maybe you realize that having a baby right now is not something that's practical for you and you want to freeze embryos. So these are all concepts that we can work on by exploring our fertility. But the first factor, regardless of whether you ever want to have kids or not, is to at least learn, what is my ovarian reserve? What is my egg count? Why? So that you can be proactive. That's one of the things we feel really passionate about at Kindbody, is that the standard in women's health right now is to wait for a woman to have a problem and then turn around and help her fix it. And what we want to change is we want you to be preventative about your fertility, the same way you're preventative about your weight or about your diet, because you don't want to get diabetes, you don't want to get high blood pressure. We want to empower you to be preventative about your fertility, because a lot rides on it, right? Our ability to conceive, our desire to be parents is a big deal. And so we think that it's a little bit too important to leave to chance. Next slide. All right, so let's go back to a little bit of basics. So when are we fertile? Like, what is this all about, right? Because again, we spend our whole lives thinking the moment we have unprotected sex, we're going to get pregnant, and then we're constantly, in that realm. And so when are we most fertile? And the reality of it is that we're really only fertile for about 5 days a month. In this example of May 2020, the red dot represents the first of a person's period. And so then this person would be most fertile between May 10th through the 14th day, the 14th day of ovulation, meaning the day that one of her eggs fully matures. And so those would be the days in a woman who has a perfect cycle. She gets her periods every 28 days like clockwork. She would be most fertile between May 10th through the 14th. And so it's really like 72 hours that we're fertile. And that's one of the other things that's kind of a misconception, is that when people ask, well, how successful is it doing IUI? How successful is IVF to achieve a pregnancy? People compare it to 100%. But our natural capability to conceive in any given month in a perfectly fertile man and woman is only 25% chance a month. And so it's really important to understand all of those fundamentals. So that way, when you are having a fertility issue, or if you're just thinking about trying to conceive for the first time, or maybe you're trying to not get pregnant, these are the facts to have so that you make them educatedly and not just on fear. Next slide. All right. So what other factors impact fertility? Obviously, egg count is really important, but there's certainly other factors. And we know that diet and lifestyle can play a role. Family history can play a role, and as well as our mental health is so imperatively important, just because our mental health and our mental well-being are imperative to our menstrual cycles, to our health, and obviously to having a healthy pregnancy and just being a healthy individual as a whole. And so that's why we have nutritionists and mental health experts to help you through this journey. When I talk about family history, a lot of times women will come to me and be like, oh, well, I'm not really worried about my fertility because my mom had my brother when she was 42, or I know there's women in my family who had kids later in life, so I'm going to be fine. And while that's great, it's not always a direct correlation. And so, but one factor that is important is if you do have a family history of your mom or your grandmother or women in your family going through early menopause, I mean, they stopped getting their periods completely under the age of 45, that's really important because that puts you as a young person at risk for potentially going through early menopause too, which would then indicate or could indicate that your egg counts may decline at a faster rate. And so that's an important thing, maybe this holiday season, whether you're getting together with your family virtually or in person, to ask those women in your family, hey, how old were you when you stopped getting your periods? And then if it's less than 45, that would be a good topic for us to discuss when you come and see us. Next slide. All right, so at the end of the day, the key is there's no magic formula. There's nothing that we can do to make our fertility better. There's nothing that we can do to stop time. There's nothing we can do to make ourselves younger. And we also can't predict the future, right? If you're listening to me as a single woman, you have no idea when you'll be ready to have a child, or you might be in a relationship, but you and your partner aren't quite ready to take that next step. Whether you're in a same-sex relationship or you're in a heterosexual relationship, there's so many factors that come into play to say, okay, I'm ready to be a parent, or I'm ready to be a mom. And so the fundamental truth is that let's at least learn where we personally stand today, regardless of where we are in our journey, so we can make the right decisions. So how do we do that? Let's get started. Next slide. All right. So how do we do a fertility assessment, right? So fertility assessment is how we can factually check and see what your egg count is at. So it starts off with a one-on-one consultation with one of our fertility specialists. And those can be done virtually or in the clinic. So now more than ever, that becomes important. And you can book those directly through our website. Just go to kindbody.com and you can do a fertility consultation. So during that first step, we're talking about your medical history, your surgical history. Do you smoke? Do you drink? How are your periods? How often do you get them? Are you on birth control? Do you have an IUD? Where are you kind of in your journey? And also talking about how many children do you want to have? Are you single? Are you dating? All of those aspects we'll talk about in detail. The second part of a fertility assessment, if you're in the clinic, would happen on the same day. If you're virtual, we would schedule for you to come in to do, is a vaginal ultrasound. The ultrasound allows us to actually look at the uterus, look at the ovaries structurally. Do you have any cysts? Do you have any fibroids? Is there anything structurally that could be posing a problem? In addition, we look at follicles within the ovaries, and follicles are premature eggs that your body recruits in a given month. And I'll give you guys a visual to explain that in a second. But we do a vaginal ultrasound, so that's really important part of assessing your egg count. And then the next thing we do is do a blood test that checks specifically a hormone called anti-Müllerian hormone that gives us an estimate of your ovarian reserve. So thinking back to, remember you were born with 2 million eggs, the AMH is almost like a gauge saying, well, how many do we now have left? It's reported as a score. So it's the combination of the ultrasound and the blood test AMH that's going to allow us to tell you what is your egg count. And then we combine that with all the information we gain during your consultation to then help you understand where do you stand today, and then what decisions do you want to make as you think about your future family. And then just on the right here where you see in navy, and I know the writing is small, but just one of the other things that I think is really special about Kindbody is that you'll have your own designated patient portal where all of your results will live. So I'm sure anyone can attest to going to the doctor's office and you do tests, and then later you're like, I'm not sure what test I had. I don't actually know what the results mean, but we really present it to you in a really intuitive fashion. So you'll not only get your AMH results and your follicle counts, but you'll have really descriptive references to better understand what those results mean. Next slide. All right. And then once you do your assessment, we can then talk about your options. Is a good option for you egg freezing? Is it better to do embryo freezing? We'll talk about the difference in just a moment. But then if you're trying to conceive and you're ready to be pregnant, and maybe you've already experienced some miscarriages or losses or fertility failures, or maybe you've just been trying for a year or longer and you haven't been able to get pregnant, we can talk about, is intrauterine insemination a better option for you, or is IVF a better option? So once we know your truth, then we can help explore what pathway makes sense for you. Or you might just say, you know what? I just wanted to know where I stand and I'm not interested in any of these options. I'm just going to go try to get pregnant on my own with my partner. And so that's key, is that the answer isn't the same for everyone, but we want to empower you with your choices. Next slide. All right, so what is egg freezing? I'm going to grab a tissue box, excuse me. Hi, I'm back. All right, so I'm going to give you guys this tissue box analogy that I think really helps explain this. So imagine this tissue box is your ovaries. So you have a right ovary and a left ovary. And when you were born, it was full of tissues. So meaning when you were born, your ovaries were full of eggs. And with time, it'll deplete. So the AMH level, remember I mentioned to you, we check a blood test. The AMH level would then serve as like a gauge of how many eggs do you have left in total. Because when you look at this tissue box, you can't tell how many tissues are in there. Well, when we look at your ovaries on an ultrasound, we can't tell how many eggs are in your ovaries either. So the AMH would be almost like if there was some sort of gauge on this tissue box that would say 6 is full, 5, 4, 3, 2, 1, all the way down to 0. So that's how the AMH can be helpful. And then what happens is each month, your body takes a group of your eggs and recruits them to grow. This group of eggs that your body recruited, we can actually count. So when we do an ultrasound, we can say your body recruited 20 eggs this month. Then what naturally occurs is your brain sends a signal to these 20 eggs to help one egg fully mature. And this one fully mature egg is ovulation, and it's the only egg in your entire body that has the capacity or capability of becoming a baby. And what naturally occurs when you don't have sex or you're not getting pregnant, this one mature egg is lost. This entire group of eggs are lost. And next month, your body will recruit again from your stockpile. And this cycle will continue until you run out of eggs. Okay? So what we do with egg freezing is we say, okay, you've got this group of eggs that you're going to lose in the next 30 days. We know that only a mature egg has the capability of becoming a baby. So, and how does this occur? This process of one egg maturing occurs with help from hormones that are released from your brain. So what we do is we give you that exact same hormone that helps this happen at a higher dose with the help of helping the entire group mature together, so that once they're mature, we can extract this group of eggs and save them for you to use in the future. Why is it important to understand this? Well, number one, we're not stealing from your fertility. So a lot of women will say, oh, well, if I come freeze my eggs, am I going to then have less eggs? And will it then be harder for me to get pregnant in the future? Am I going to go into menopause early? And all we're doing is being opportunistic. We're just taking a group of eggs that you're going to lose anyway in the next 30 days, and we're going to help them mature and then extract them. So by the virtue of that, though, we're only able to help eggs mature. We can't make more eggs. We can't make new eggs. We can't make better eggs. All we're able to do is help a group of eggs mature. And the final part is, unfortunately, nothing in the human body is 100%. So if you have 20 eggs, you're not going to end with 20 mature. If you have 20 eggs, you hopefully end up with 14 or 15 mature eggs in a perfect response. And so that's the other part to keep in mind. But that's all egg freezing is a process by which we are helping a group of eggs mature, and we're saving them. We're being basically opportunistic and saving them for you to use in the future. Next slide. All right. And go one more slide for me, and I'll come back to this. So one more. And one more. It's way ahead. Okay, never mind. You can go. Sorry, I thought it was the next one. You can come back. Yeah. So that's the process, and I'll show you guys a calendar to kind of go through it again. But before you think about doing egg freezing, one really important thing to think about is, okay, so I understand you're going to help a group of my eggs mature. I understand not all of the eggs will mature, but how does this all work, or why is this important to me? And these are really important 4 fundamental questions that I want all of you guys to think about. And if you happen to have a partner, answer these questions on your own before you share them with your partner, and then see if you both agree. Number 1, which should hopefully be very easy, is how old are you? Number 2 is how many kids are in your ideal family? And be honest, maybe that number is 0, or maybe that number is 4, but whatever it is, how many kids are in your ideal dream family? The third question, I think, is really a little more difficult, and it's realistically, how old will you be when you have your first child? Not how old you hope that you will be, but realistically based on your current life, based on your finances, based on your career aspirations, based on your job, your partner, etc. How old will you be realistically when you have your first child? And then just as important, and maybe even more important, if you wish to have more than one child, how old will you be when you have your last child? Recognizing that pregnancy itself is a year, and medical recommendation is wait 1 year from the birth of a child to the start of the next pregnancy, right? So the bare minimum in between is going to be 2 years. So how old will you be when you have your first child? And then realistically, how old will you be when you have your last? And those are important numbers to think about, especially if you find that you're going to have one or all of your children past the age of 35, then it would be important to consider egg freezing. Next slide. All right, so I will walk you guys through how egg freezing works. So that is the whole process we just talked about with my tissue box analogy. Next slide. All right, and the whole key is that with egg freezing, we're just being opportunistic. really important to understand that you're not going to go into early menopause. There's no long-term side effects of doing egg freezing. In reality, you could actually freeze your eggs in December and then try to get pregnant naturally in January. So it doesn't even throw off your cycle as you think about those types of family planning opportunities. Next slide. And the hormones, the injections, are a part that I think really scare a lot of people. Sure, and I totally understand who wants to like think about giving themselves injections. The injections are actually really small, really, really small. If any of you guys know someone who has diabetes, they're actually the same caliber of needles that are used for diabetes. But we do really extensive teaching with you. There's videos that you can watch through your portal to help get you comfortable with the medications. We have nursing teams available to you 20 hours a day. They'll even FaceTime you and talk you through the injections. So we really do that part. And then the other part is what I explained to you of this process of helping a group of eggs mature is truly over only a 10 to 12 days of injections. And so it's not like you're giving yourself shots for months on end. It's really just 10 to 12 days. And obviously how you respond and how many times you'll need to do that will depend on how many children you want and what we tell you after that initial assessment. But no, the injections can be scary, and why they're needed is to help your eggs mature. We'll teach you through that whole process, really hands-on, one-on-one, and it's only for about 10 to 12 days. Next slide. All right, this is what I was looking for before. Sorry about that. So what I was describing to you guys with this tissue box analogy of helping these group of eggs that were recruited and helping them mature is done just over 2 weeks. So if you look at this graph and you'll see that yellow sign that's under the Wednesday, that would be the first day of a period. And then the cycle would start 2 days later on that Friday. And the maximum amount of time this entire process would take would be 14 days. Could actually end up being shorter. But if you and 10 friends all happened to start on that same Friday, you would all end up finishing slightly differently in that final week. But overall, the entire process from beginning to end would only take 14 days maximum and could actually even be shorter. And so when you think about, okay, it's 10 days of injections, I'm freaked out about injections, I really don't like that concept, but then you think about what you could potentially gain, and the fact that it's really just 14 days total makes this a lot more palatable, I think. Next slide. All right. And so how does retrieval work, right? Remember I mentioned to you we're helping a group of eggs, we're helping that maturity occur through the injections. Well, once your group, a majority of your eggs have reached maturity, we need to extract them. And that extraction is done under a twilight sedation. So you're asleep, not like general anesthesia with a tube down your throat, but just a twilight IV sedation. And the whole procedure only takes 10 to 15 minutes. It's done through a small needle pass through the vagina, and there's guidance done with a sonogram. So really straightforward, no cuts, no incisions. It's really not considered a surgery, but very minor procedure. And it's all done within our facilities. That day, someone would need to take you home. When we talk about that entire 2-week period, you're still going about normal daily activities. And this one day of the retrieval would be the only day that someone would need to take you home because of the anesthetic. And the day after the retrieval, you can truly go back to your normal activities. Next slide. All right. So we just walked through egg freezing. And so a lot of times a very common question as we talk about fertility is, should I freeze eggs or should I freeze embryos? The fundamental thing to understand is that a lot of times if you Google or you've looked at old literature, it will always favor embryo freezing. And the reason for that is that prior to the advent of some really great advances in science as far as it relates to egg freezing, eggs are very fragile and they would basically break during this process. And so egg freezing itself wasn't very good because the science wasn't good. And so during those times, embryo freezing was really the best and only choice that a couple would have because eggs are so fragile and the egg freezing thawing process was not good. Now fast forward to 2020 and really over the last 10 years, this process of vitrification, which has really helped and completely changed this entire process, has now really equaled the playing field. So if I take your eggs today and I fertilize them today, or I take those same eggs and I fertilize them in 20 years, they're going to behave exactly the same. Meaning your eggs, how they behave will depend mostly on how many eggs you have and how old you are at the time retrieved. But whether we fertilize them today or fertilize them in 10 years, they're going to behave exactly the same. The key difference between egg and embryo freezing is that with embryo freezing, you end up having more information. Why? Because we're actually taking the egg, we're fertilizing it with sperm, we're creating an embryo. You can then biopsy the embryo and know the genetics of the embryo. Is it genetically normal? Is it genetically abnormal? And that added feature of being able to check the genetics then allows you to know exactly what you're dealing with, right? And if you're in a situation where you're ready to either pick a donor or you have a partner and you want to make embryos, then sure, it's a wonderful option. But if you're in a position where you're currently single and you would like to have children with a future partner and you don't want to commit to donor sperm right now, then egg freezing would be the better option. So the fundamental thing to understand is once we fertilize an egg, you can't unfertilize it. And so you're stuck with that sperm. That's a big decision, right? And so sometimes even married couples will choose to only freeze eggs or may choose to do half eggs, half embryos, just in thinking, and again, not to be a Debbie Downer, but what if you get divorced? What if later in life you want to have children with someone else? And so that's where if someone has good fertility and they're young, in their 20s, mid to mid 30s, and they have the option of just freezing eggs, that's typically going to be a better choice. But we'll counsel you based on your individual statistics of whether embryo freezing might be a benefit. But the key thing to understand is that eggs and embryos behave the same. It's just there's more information with embryos. Next slide. All right, so what comes next? You've stored eggs, and let's say you just decided to freeze eggs and you went through the process and it wasn't as bad as you thought, and you actually tolerated quite well, which most people do. Really, the most common side effects are some bloating, a little more tired than usual, and some mild cramping at the time of retrieval. But now you have frozen eggs, so what do you do with them? Well, my personal hope, and our hope at Kindbody is that every woman who freezes her eggs never needs to use them. And what do I mean by that? I hope you freeze your eggs proactively, and when the time comes, you're able to get pregnant naturally, eggs for free at home. Like nothing beats that. So I hope that. But in the event that you're either not able to conceive naturally or you don't want to conceive naturally because you're in a same-sex relationship and you're going to have your partner carry the baby, or you choose to have a baby on your own and you need to go through IVF, then the whole process is you've already have the eggs. So we'll then take your eggs that you froze back in 2020, fertilize them with sperm, create an embryo, and then put that embryo back in your uterus to grow. So egg freezing is just the first half of IVF. The only difference between a person who's doing egg freezing and a person doing IVF is when they want to be pregnant. A woman who's doing egg freezing wants to be pregnant in the future. A woman who does IVF wants to be pregnant today. And so the day the eggs are retrieved, in a person who wants to do egg freezing, those eggs are then stored and frozen. We're done. And a person who wants to do IVF, the same day those eggs are retrieved, that same 14-day cycle, those same tissue box analogy I gave you, but at the end, when the eggs are retrieved, they're then fertilized with sperm. And that sperm could be your partner, that sperm could be donor, that choice is totally yours. Next slide. So that's what we were just talking about. So in vitro fertilization is exactly the same process as egg freezing, but we're just taking those eggs and we're fertilizing them with sperm. And then once we have a genetically normal embryo, we're transferring the embryo back in the uterus to grow. One of the benefits of having eggs frozen earlier in life is that it will improve your chances of having a successful pregnancy, because typically those eggs will be younger. And by the virtue of being younger, they'll have better quality. Next slide. All right. So let's talk about, we've been talking about fertility, but let's talk about some of the definitions of what does it actually mean to be infertile, or what is the definition of infertility? Infertility means that it varies based on your age. So if you are over the age of 35, then you would be considered infertile if you've tried to conceive naturally for 6 months and have not achieved a pregnancy. And if you're under the age of 35, if you have tried for 12 consecutive months to conceive and you have not been successful, that would be considered infertile, right? So under the age of 35, 1 year of trying naturally would then be considered infertile. Over the age of 35, 6 months of trying would be considered infertile. And with those definitions, 1 out of 8 couples will experience infertility. And then something that most people don't know is that 1/3 of couples that are experiencing infertility issues, it's actually because of the man. And so I know we haven't talked about sperm at all during this conversation, but I strongly advise each and every one of you, if you have a partner that you want to have children with now, or you have a partner that you envision having children with in the future, just as important as learning your own facts and learning about your own fertility is to have them do a semen analysis. And the process is much easier for men. It's literally ejaculating into a cup and checking their sperm, but that semen analysis becomes so vitally important. Not so much in the same sense for women, in that men make new sperm every 72 days. And so they're not really at risk of losing sperm count as they age, but just that 1/3 of men have low sperm counts or have poor swimming or have poor shape, and those can impact fertility. And then one last thing on this topic is that, so I just gave you definitions, right? If you're over 35, try for 6 months, and that means you're infertile. If you're under 35, try for a year. But what I want to embark upon all of you, and if you heard nothing more of this conversation, is why I don't want you to waste that 6 months or a year to then find out that you could have known a year ago that your egg count was low. So I really encourage you, that even if you're not quite ready to start, or maybe you're thinking, we're going to start trying next year or soon, there's no harm in going and making sure his sperm is good, your egg counts are good, just getting everything checked out so that you start your path with peace of mind. And, I know this is what a lot of women get scared about, but the reality is in the event that you do get bad news, then it's something we can help with. And the sooner we find out, typically the more options you have. And so that's just something I really want to convey, is that we don't need to wait till we have a diagnosis to just make sure we're okay. In the same sense that you don't wait for someone to have a heart attack to encourage them to lose weight or to eat better or change their diet. Next slide. All right, so there's a lot of paths to parenthood. And let's say you have found out that you do have an infertility diagnosis, or you're perfectly fine, and maybe you are in an acceptable situation, you didn't want to have the baby on your own, so we can do intrauterine insemination with donor sperm or partner sperm. We can also do in vitro fertilization, which can also happen with donor egg, donor sperm. We can even just help you ovulate. Maybe everything is perfect, but you just don't get your periods on a monthly basis. And so just helping ovulation induction, so that we're just promoting ovulation, and then you go home and have sex to help you conceive. So there's a lot of pathway achieving a pregnancy, and a lot of family building up. As I mentioned, egg donors, sperm donors, even gestational carriers. If you either don't have a female partner, or your female partner is not healthy enough or able to carry a pregnancy. The key part of this is that a lot of times people have a concept that if you're not able to get pregnant naturally, then you must need IVF. And what I want to relay is that the solution to all fertility problems is not IVF. And there's a lot of steps beforehand. And so at Kindbody, our physicians and our providers, we really want to be your partners in exploring those options, and then picking a decision, picking a pathway, picking a treatment that is right for you, and where you are in your life, and really allowing you to take baby steps if that's what you want to do. We're obviously going to give you the best information that we can, and we're going to advise you as best as we can with what pathway is going to give you the most success. But we're also wanting to be your partner in this journey so that we can pick the treatment and the options that work best for you, where you are in your journey and what you're ready to proceed with. And sometimes that's not IVF quite yet. Maybe you wanted to take some baby steps before we get to that journey. And if you're the right candidate, we'll let you take those baby steps, and we'll be honest with you and forefront, and not lead you astray, but also really wanting to share this floor with you and be a partner in that journey. Next slide. All right, so your next steps, whether you are actively trying to get pregnant, or maybe you're actively trying to not get pregnant, whether you are ready to have a baby, in this new year, 2020, or you would like to have kids in 10 years, or maybe you're someone who wished they were pregnant yesterday and you've already been through some bad experiences with miscarriages or this journey. But wherever you are in this process, the first thing to do is just to get more information. Is to come in for that assessment. Let's learn about your egg count. Let's learn about your uterus, your ovaries, your ovarian reserve. Let's learn about the semen analysis if your partner has one. And then once we have that factual information, we can take that and then help you understand, well, here are your options, and and then you can make decisions that are right for you. Next slide. All right. So no fertility discussion would be complete without addressing, the elephant in the room, which can be sometimes the cost. And so we really value that this is a area of treatment that can be expensive. We recognize that. And so our prices are actually typically significantly lower than most fertility centers. And we do that because we want to improve access. And we want you to have an opportunity to have a family of your dreams and not be in the top 1%. So we do have discounts. We are doing it for the holidays. So the code for it is holidays. So you can go to kindbody.com and do book now and just follow the instructions. It's very simple. You'll create an account. And then for fertility assessments, if you're paying cash, they're discounted by 50%. So it'd be $150. Otherwise, you might just be paying a copay because we do accept all major insurances. An egg freezing cycle is typically $6,500. With our holidays special, it's $5,500. And an IVF cycle is $11,000 with the code. So just go to body.com, and all of these specials are good. We need you to make your appointment. The discounts will be applied to your account. It doesn't mean that you have to make any decisions about doing any of these treatments now, but they will then be valid in your account for future use. Next slide, just brief talking about the fact that we do accept all major insurances. They're all listed here. And if you do have any specific questions about your insurance or about your coverage, you can email us at navigator@kindbody.com, but we're in full network with all of these providers, and that includes for full service gynecology and full spectrum fertility care. And we have specialist team that can help you explore your benefits and better understand what your deductibles and copays and everything be. Next slide. And I think that's it. Oh, we also work with employers. So we have been actively championing going to different companies and add Kindbody as a benefit. So some of you that are joining us today might work at one of these places that are listed. This is actually not a comprehensive list. We do have other companies that are a benefit as well. And so in those cases, you may even have an entire cycle covered for free or for a fraction of the cost. And so, and if you have to work somewhere where you don't have a benefit, reach out to us as well. We have actually an entire team of specialists that can help you champion the cause for the other women and men in your company to help add fertility benefits. And then the last slide, I think, is for questions. And I know our team has been monitoring the chat very closely. So I will hand it to Rebecca, who will tell us some of the questions, and I'll be happy to answer them. And then lastly, if you do have a question that we're sharing publicly, First and foremost, know that any question that you have is probably the same question everybody has. This is a safe place, and I assure you that any question you have is probably something someone else has as well. But if you still have something that you just don't want to share publicly, please email us at navigator@kindbody.com and we will definitely get back to you. So Rebecca, what questions are there?
Yeah, there's been a lot of wonderful questions. We've tried to answer as many as we can. I'll just relay some of the more common ones we've gotten. We had a few questions about how long frozen eggs will last for. Can you speak to that?
Absolutely. So that's the magic of freezing. Once they're frozen, they're going to be as good as the day they were frozen for literally 100 years, far longer than any of you will still want to have children. And so that's the beauty and magic. So whether you have frozen eggs or frozen embryos, whether they're frozen for 1 year or 20 years or 50 years, they will still be as good. And actually, if you guys had been watching the news recently, there was a baby born of an embryo that had been frozen for 27 years that broke some of the records. But that just goes to show you that this science is real, and it's the cutest, chubbiest little baby too. But yeah, there's a time limit, so you don't have to overcalculate. Like, I'm only 27, I want to have a kid at 37. Once they're frozen, they're going to be as good as the day they were frozen, for much longer than you and I will be around.
Thank you. Is the fertility assessment always the first step? What if someone's had a fertility assessment at another clinic or a year ago? What do you recommend?
Yeah, so we still need to start from, every marathon still starts at the start line. And so we definitely, if you've had testing done, we love it if you bring it with you to your initial appointment. And we definitely don't make you repeat anything just because. I know some fertility clinics mandate that you repeat everything or start over from scratch, and we definitely don't do that. But you still want to start with your initial appointment, because that will help us understand where you are in your journey. And if you've had blood work and ultrasound and a workup done previously, great. We'll take that information and say, okay, here's your next steps, or here's our recommendations. But it would always still start with a fertility assessment. And then to the person who was asking if they'd had it a year ago, well, hopefully after listening to this, you understand that our fertility changes with time. So if it's been a year, we would want to repeat the follicle count and the AMH level, because they may have declined. And that will be important as we give you your next steps.
Thank you. When you are trying to conceive, how long is it recommended to be off birth control beforehand? And what do you recommend in terms of prenatal vitamins?
Well, you said when you're ready to conceive. Was that the start of the question?
Conceive, how long should you be off birth control for? And what do you recommend in terms of prenatal vitamins?
Yeah, so birth control works while you're using it, and then it stops working. So I would advise you to stop your birth control when you're ready to be pregnant. And there's science. I know there's a lot of misinformation out there that you need to wean off your birth control, or that you need to cleanse your body of your birth control, but that's really not true. So whether you have an IUD or you're on birth control pills or whatever the case may be, you should stop your birth control when you say, okay, if I get pregnant this next month, I'm ready, then that was the right time. And as far as prenatal vitamins, we actually have a prenatal vitamin that's non-GMO and really nicely formulated, that you can purchase through our website. Then so just go to kindbody.com and we'll ship it right to your house. And so that's a great prenatal vitamin. And prenatal vitamins should be started 2 to 3 months before you start trying. So that is important, to start those 2 to 3 months before you start trying. And that's because you want to get really good folic acid levels in your system. Folic acid is instrumentally important for the development of the brain and the spinal column. But that's it. And then obviously, if you're on other medications that you might need to stop, those are things we would explore with you one-on-one when you come in for your consultation.
How many eggs or embryos do you recommend freezing?
Yeah, that's the billion-dollar question. So that's a really great question, and it kind of speaks to the fact that that I think sometimes patients think that we as doctors can control how many you end up getting. But the whole concept is if you are a woman in your 20s and up to about the age of 35, we want 10 eggs for the improved chance of one baby. And the reason for that is of any 10 eggs, some of the eggs will not fertilize. Some of the eggs will fertilize and not grow. Some of the eggs will fertilize, even in a young person, be genetically abnormal, and hopefully you'll get left with one. And so it's a 10-to-1 ratio for eggs. So if you come to me and say, you know, I aspire to have 2 kids, then our goal would be to freeze 20 eggs. And so we may get 20 eggs out of one round. Remember the tissue box analogy? So if your body's recruiting 30 eggs and we're able to mature 20 of them and extract them, then you're one cycle and you're done. If someone has less poor fertility, they may need to do multiple cycles to get to that 20 goal. As far as embryos, if they're genetically tested and we know that they're genetically normal, that's going to be the key. Then it'll depend on how many children you want. And nothing in human life or human reproduction, maybe as this year has shown us more than ever, is a guarantee. And so it's never going to be a 1-to-1 ratio. So not every embryo will be a kid 9 months, 10 months later, and not every egg will end up being a baby. And so it's really taking that into consideration. And understanding that you're always going to have to account for some of them just won't take.
Okay.
Other questions?
Just one or two more, and then we'll sign off. Does birth control affect your fertility at all? If you got a fertility test and got low results, would you recommend stopping birth control, or does that not make a difference?
Yeah. So wonderful question. I'm so glad you asked it. To come in for your fertility assessment, we really advise you to come as you are. So if you have an IUD, come with your IUD. If you're on birth control, come on your birth control. Whatever you Depo-Provera shot, the NuvaRing, then the implant, whatever you have. To come in for the assessment, you should just come as you are. You don't need to come during a special time in your cycle. You don't need to come on your period. None of that. We can do the kind of fundamental testing at any time during your cycle, and even when you're on contraception. The caveat is that in some women who have been on hormonal contraception for 10 consecutive years or more, some of those women can have kind of falsely low AMH levels and falsely low follicle counts. And in those cases, if you've been on contraception for 10 or more consecutive years, we may advise you to stop your birth control for 30 to 60 days and then come back and repeat it to see if there's an improvement. But for the vast majority of women, and this has been well studied, being on birth control does not harm your AMH levels, and certainly being on birth control does not harm our fertility in any way. So you can rest assured to continue to use your birth control without feeling that you're somehow harming your ability to have children in the future.
Amazing, thank you. So I think that's all of our time. I wanted to point out that all the discount codes will be emailed to everybody out tomorrow. So we are offering a discount on egg freezing, IVF, IUI, and fertility assessment. So we'll send you all that information as well as the code, which is holidays, but we'll send that to you as well as the recording of this event. So with that, I'll pass it back to you to say goodbye.
All right. So thank you guys so much for joining us. I certainly know that 2020 has been a year like none other. I hope that you found this last hour informative. Please don't hesitate to reach out to us if you did have further questions. And we just want you to know that we're here to be your partners in this journey. We really want to empower you with information and choices and options. And whether you need gynecologic care or fertility care, we're here to be that for you, both in California and New York and beyond. And thank you for this time, and Merry Christmas and Happy Hanukkah and Happy New Year. Have a great night. Bye, everyone. Bye-bye. Thanks for joining us.